The third part of Chapter 13 looks at viral infections. We're going to briefly talk about these because a lot of these viral infections already have vaccines that people typically get, and we avoid having these viral infections at the athletic setting or other potential settings such as gyms or in the clinics. Viruses for viral infections are small microorganisms that cause illness. Once in the body, they take over the body's healthy cells, and then they replicate and eventually kill the cells within the body. Some viruses are stronger than others. If an athlete has one of these infections, he or she must not be allowed to continue participating at the facility until they are no longer contagious or have been cleared by a physician. Likewise, the facility must be thoroughly and regularly cleaned. Viral infections do not respond to medications such as antibiotics. Therefore, we have to let these infections run their course, and they are very difficult to treat. First, we will look at measles. Measles is a viral respiratory infection that most often affects children. It is very contagious and typically includes signs and symptoms of itchy red rash from head to toe, fever, sneezing, coughing, sore throat, runny nose, muscle pain, fatigue, conjunctivitis, white spots in the mouth, and sensitivity to light. Typically, 10% of children also sustain an ear infection if they have measles, and 5% come down with pneumonia, which most often causes death in children. For measles, there is a vaccine that exists. Remember, there is no medication that can cure measles, so the infection must run its course. However, if we do have somebody with measles, the athlete can take acetaminophen for aches and pains, use a humidifier to moisten the air passageways, and get plenty of bed rest to combat fatigue that they feel with measles. Our next one is mumps. Mumps is an uncommon viral infection that, like measles, most often affects children. The infection thrives in the parotid glands, which are the salivary glands below and in front of the ears. The virus is transmitted by saliva when an infected person sneezes or coughs, and another person breathes in the molecules in the air. A person can also be infected if they drink out of the same cup that an infected person has used. The person is contagious for 1 week after signs and symptoms are evident. Typical signs and symptoms, which can appear 2 to 3 weeks after infection, include swelling of and painful parotid glands, fever, fatigue, weakness and pain with chewing or swallowing. The only treatment for mumps is acetaminophen, ice or heat packs on the neck, fluids, warm saltwater gargles, and rest. The infection usually clears in 2 weeks. An athlete with suspected mumps must be evaluated by a physician. For prevention, there is a vaccine that creates immunity for mumps. Rubella, or German measles, is a contagious disease caused by a virus spread through close contact with an infected person or the air. Children are most commonly affected by rubella. As with measles, rubella also causes a rash. A person is contagious 1 week prior to the rash eruption and 1 to 2 weeks afterwards. Typical signs and symptoms are fatigue, weakness, joint pain, runny nose, and headache may exist, although sometimes children have few signs and symptoms. No treatment exists for rubella. Athletes can take acetaminophen to decrease aches and pains, but a person should receive the MMR vaccine as a child to be immune to rubella. The last infection that we will discuss is varicella, or chickenpox. The varicella or chickenpox is caused by the contagious varicella zoster virus, which affects mostly children. There is a vaccine that exists and is given to children to prevent chickenpox. When we look at the spread of varicella, it is spread through water molecules in the air from an infected person who sneezes or coughs or direct contact with the infected person's rash. The infection causes various signs and symptoms resembling the flu, such as fever, aches and pains, fatigue, weakness, headache, dry cough, and loss of appetite. The person will also have itchy, red rash that can occur all over the body. The rash first appears like pink or red bumps, which turn into fluid-filled blisters. For varicella, the person is contagious for 2 days before the rash appears and until all blisters have crusted over. For treatment, we want to refer them to a physician who may prescribe an antihistamine to lessen the itching. For more severe infections, they may be prescribed antiviral medication to decrease the duration and signs and symptoms of the infection. After chickenpox infection, the varicella zoster virus remains dormant in the body's nerve roots. If a person, typically an older adult, has a weakened immune system, this virus can be active and cause shingles.